Pancreatic cancer is one of the most formidable challenges in modern oncology. Ranking as the third leading cause of cancer-related deaths in the United States, its impact is devastating, largely due to its elusive early detection. This disease affects the pancreas, a crucial organ responsible for digestion and blood sugar regulation. Unfortunately, its deep location in the abdomen often masks the symptoms until the cancer is in advanced stages. However, by recognizing subtle warning signs, we can improve early detection and, potentially, survival outcomes. In this article, we will delve into 6 critical symptoms of pancreatic cancer, discuss risk factors, and offer actionable advice on maintaining your health. We'll also share stories and examples that illustrate these points, ensuring a compelling narrative from start to finish. Let's embark on this essential health journey. 1. Jaundice, the canary in the coal mine. One of the earliest and most visible signs of pancreatic cancer is jaundice, a condition characterized by the yellowing of the skin and the whites of the eyes. This condition occurs when there is an excess buildup of bilirubin, a yellowish substance that is produced when the liver breaks down old red blood cells. Under normal circumstances, bilirubin is processed by the liver and excreted through the bile into the digestive system. However, in the case of pancreatic cancer, a tumor located in or near the pancreas can obstruct the bile duct, which is the pathway that carries bile from the liver and gallbladder to the intestines. When the bile duct is blocked, it prevents the normal flow of bile, causing bilirubin to accumulate in the bloodstream. This accumulation leads to the characteristic yellowing of the skin, eyes, and mucous membranes, a condition known as jaundice. Jaundice in pancreatic cancer is often one of the first noticeable symptoms, and it can appear suddenly or gradually. It is a significant sign that warrants immediate medical attention, as it can indicate the presence of a pancreatic tumor that may need further evaluation and treatment. Visibility. Unlike internal symptoms, jaundice is outwardly noticeable, making it a critical early warning sign. Differential diagnosis. While jaundice may also result from hepatitis or gallstones, its association with other symptoms like abdominal pain can hint at pancreatic cancer. Emma, a 54-year-old accountant, noticed a yellowish tint in her eyes while applying makeup. She dismissed it as fatigue from long work hours. However, when her colleagues pointed out her visibly yellow skin, she decided to see her doctor. Early intervention led to the discovery of a small pancreatic tumor, caught just in time for successful treatment. Emma's story underscores the importance of paying attention to visible changes in your body. 2. Persistent nausea and vomiting. Persistent and unexplained nausea and vomiting can be early and concerning indicators of pancreatic cancer. As tumors in the pancreas grow, they can exert pressure on surrounding organs, including the stomach and small intestine. This pressure can interfere with the normal functioning of the digestive system, leading to disruptions in the digestive process. Individuals may experience a sensation of fullness even after consuming small amounts of food, along with partial blockages that make it difficult for food to pass through the digestive tract. As a result, food may not be properly processed, leading to feelings of nausea and vomiting. These symptoms may worsen after eating, as the stomach and intestines struggle to handle the food due to the pressure exerted by the tumor. If nausea and vomiting persist, especially without an obvious cause, and if these symptoms become more frequent or intensify after meals, it is crucial to seek medical attention. Early recognition of these digestive issues can play an important role in the timely diagnosis of pancreatic cancer, allowing for earlier intervention and more effective treatment options. Pattern recognition. Occasional stomach upset is common, but persistent symptoms, particularly after eating fatty meals, warrant medical attention. Associated symptoms. Loss of appetite and rapid, unintentional weight loss often accompany this condition. Imagine dining at your favorite restaurant, only to find that every meal leaves you nauseous. For Michael, a retired chef, this became his reality. Initially, he attributed his discomfort to aging, but as the symptoms persisted, he sought medical advice. His diagnosis of pancreatic cancer, though daunting, came early enough for treatment to make a difference. 3. Intense itching, pruritus. Generalized itching, particularly when it occurs before the visible onset of jaundice, is often an overlooked yet significant symptom of pancreatic cancer. This intense and persistent itching stems from the buildup of bile salts in the skin, a consequence of bile flow obstruction caused by pancreatic tumors. Unlike typical itching, it is unrelenting and doesn't respond to common treatments such as moisturizers or antihistamines, making it an important early indicator that warrants medical attention. Severity. Unlike ordinary itching, this is intense, unrelenting, and unaffected by typical remedies. Early indicator. Itching may precede more overt symptoms like jaundice. Maintain a detailed symptom journal. Record not only when and where the itching occurs, but also note its intensity, duration, and any factors that might aggravate or alleviate it. This comprehensive documentation can provide your healthcare provider with valuable insights to pinpoint underlying causes and guide further investigations. 4. Abdominal pain, a silent alarm. Pain in the upper abdomen, often radiating to the back, stands out as a hallmark symptom of pancreatic cancer. This persistent, dull, and aching sensation frequently intensifies after eating, particularly heavy or fatty meals, and tends to worsen when lying down. Patients sometimes find temporary relief by leaning forward, a distinctive characteristic that can help differentiate it from common digestive issues. Unique characteristics. The pain's gnawing nature and tendency to improve when leaning forward can help differentiate it from common digestive issues. Progression. As the tumor grows, the pain may intensify and become persistent. Sophia, a yoga instructor, experienced persistent upper abdominal pain that disrupted her daily routine. Initially attributing it to muscle strain, she sought medical advice when the discomfort became unmanageable. Her proactive approach led to an early-stage diagnosis. 5. Sudden onset of diabetes. Pancreatic cancer can significantly disrupt the pancreas's ability to produce insulin, often resulting in rapid-onset diabetes. This sudden development is particularly alarming in individuals without a prior history or apparent risk factors for diabetes, and it may serve as an early warning sign of underlying pancreatic issues that require immediate attention. Distinguishing features. Unlike type 2 diabetes, which develops gradually, this condition appears suddenly and progresses quickly. Symptoms. Increased thirst, frequent urination, and unexplained weight loss are red flags. Doctors often describe pancreatic cancer-induced diabetes as a whisper rather than a shout. Subtle but rapid changes in blood sugar levels can prompt early investigation if properly recognized. 6. Changes in stool and urine. Pancreatic cancer can lead to significant and noticeable changes in stool and urine, primarily due to bile duct obstruction and the pancreas's impaired ability to aid digestion. These alterations often manifest as pale, greasy stools that may float, indicating fat malabsorption, or dark-colored urine, resulting from excessive bilirubin buildup in the bloodstream. Monitoring these changes can provide crucial early insights into pancreatic health. Stool. Pale, oily stools that float may indicate fat malabsorption. Urine. Dark, amber-colored urine can result from excess bilirubin in the bloodstream. Regularly observing changes in your bathroom habits might seem tedious, but it's a vital part of maintaining health awareness. Risk factors and preventive measures. Major risk factors. Genetics. A family history of pancreatic cancer significantly increases risk. Age. Most cases are diagnosed in individuals over 65. Lifestyle choices. Smoking, obesity, and a sedentary lifestyle elevate risk. Chronic conditions. Long-standing diabetes and chronic pancreatitis are linked to higher incidence rates. Chemical exposure. Certain industrial chemicals may contribute to risk. Preventive actions. Maintain a healthy weight. Adopt a balanced diet rich in fruits, vegetables, and whole grains. Quit smoking and limit alcohol consumption. Stay physically active. The power of vigilance. Pancreatic cancer is a silent and formidable adversary, but knowledge is a powerful weapon. Recognizing the subtle signs, from jaundice to digestive changes, can pave the way for early intervention. Stories like Emma's and Michael's remind us that paying attention to our bodies can be life-saving. By adopting a proactive approach to health and fostering open communication with healthcare providers, we can improve outcomes for ourselves and our loved ones. Remember, your health is your wealth. Share this knowledge, stay informed, and prioritize regular checkups. Together, we can make a difference.